done because I was introduced to the Vet Corps program. So let's dive into that real quick. So our Vet Corps program, this is a huge program that we operate under a grant from AmeriCorps. And so what this program does is essentially places volunteer members on academic community office sites to provide peer support and navigation around some of life's challenges in higher academia. So we operate out of 3 primary regions within the state, right? So that covers our Eastern Washington, that covers our Western Washington, except for King County. And then our other region is King County itself, because it's such a large population. Now, this program is really unique. Couple different reasons. One, it's staggered in such a way that we have up to 50 volunteers that are going to be placed within these academic sites, these community offices, and they operate on a 10-month program year. They have 3 regional coordinators, as I mentioned, that fall within those geographical areas, and those folks are there to support them as they work with the community. So what we'll do is we'll take volunteers that sign up for the program, and we'll train them up for 2 days at the beginning of the year. This looks like approximately August, late August usually. And then they'll start their program year starting at September at their community offices, at their academic campuses. So for me, I was stationed at Pacific Lutheran University. I was there for the very last year of my bachelor's degree, and I had the opportunity to work with a lot of fantastic people. So what we do when we're a Vet Corps member is we engage with those communities, right? We're looking for student veterans, we're looking for their family members, and we're trying to build connections and help them be successful, right? In whatever it is that they're trying to achieve. They might be looking for an associate's degree, a bachelor's degree. Maybe they're looking to find employment opportunities. And what those Vet Corps members are there for is to act as a resource or a node, right? So somebody would come in and say, hey, you know, I'm really struggling. I've never been in college before. I don't have really good studying skills. I don't know who to talk to. That Vet Corps member will connect them with an appropriate resource. Maybe it's a tutor or an instructor, or they'll help them to learn successful studying techniques because they've lived that experience, right? So the basis of it is that shared lived experience that we all get to go through in some way, shape, or form. In this particular instance, it's higher academia. So prior to me joining college, I had no idea what I was doing. I had never studied effectively. And I was probably, you know, the C's get degrees kid when I was in my associates. As I got into my bachelor's program, and I started actually connecting with other veterans and learning about the techniques and the tips and the tricks, learning from their previous experience, I actually improved my grades overall. And then moving into the Vet Corps program, I got to pass on that knowledge to other student veterans that were there and needed that same guidance. In addition to that, there's a number of requirements that these Vet Corps members have to meet, one of which is that they have to provide at least 3 service projects. These can be anything. It can be as small as a sock drive to collect for other homeless veterans that are in the area. It can be as large as coordinating a stand down. In fact, we've had that in the past. One of the projects that I like to highlight was that we were able to secure a fund for us to be able to send 12 student veterans on a 7-day outdoor excursion leadership skill building, expedition. And it was an absolutely fantastic experience. We didn't have to spend any dollars. We were able to secure it through donations, and people were able to have a really good time and connect with each other. This is also available for family members, so they can also apply to become Vet Corps members. And we actually want to really target our families of our veterans as well, because oftentimes they're overlooked. So providing resources, providing that peer support and guidance is really the heart of this program. As I mentioned, they work on a 10-month program year. They do receive a stipend for their time. And so for the next program year, which will start September of 2023, let me move this out of the way. We're going to be looking at providing them approximately a $2,300 monthly stipend. This is not taxed. So this goes directly to them. And if they complete their program and meet the requirements, they're also eligible for the Siegel Grant Education Award, which next year will be approximately $6,800 that they can put towards education costs, paying back student debt, looking towards placing it for daycare costs, anything that they can use it for towards their education, really. What you can do with this education award is you can actually use this to pay your monthly student loan debt as well, which is a fantastic way to kind of cushion some of that transition period when you're finishing your college degree and when you're looking for work as well. So it can be very beneficial. I absolutely love this program. I served in this program from 2019 to 2021. And it was one of the most rewarding experiences I could have had. It turned my life around in a way that allowed me to be more social, develop more peer networking skills, and to have more support and connection to the community. So taking a look at our next program here, and moving along the timeline of my time with the WDVA, is our suicide prevention program. So as I mentioned, I was in the Vet Corps program for 2 years, and then I saw an opportunity to really become embedded within the agency. With the previous program, it's volunteer-based. And so I was looking for my first opportunity to get my first real career after getting out of the military and finishing my college degree. Suicide prevention was the way. So I applied for this position and I got to learn about it as I jumped into it. And what the suicide prevention team does is some absolutely fantastic work. We have a team of 4 suicide prevention peer specialists that work within the community to provide education on suicide prevention best practices. And that takes the form of our Learn Saves Lives suicide prevention training. It's a 2-hour training. And you walk away with relevant skills, how to have that conversation and ask that difficult question. Are you thinking about taking your own life? We provide it to anybody. It can be veterans, it can be company organizations. We want to provide it to as many people as possible. But that's just the first level of the suicide prevention team. This program escalates all the way up to the government level. We operate within the Governor's Challenge and have been working on the Washington State Service Member, Veteran, and Family Suicide Prevention Strategic Plan since 2021, where we have identified 3 target areas to focus on in best efforts to prevent veteran suicide. So identifying service members, veterans, and their family members, and screening for suicide risks, promoting connection and care transitions, and then lethal means safety, and talking about securing any possible lethal means, whether it's firearms, medications, or any abstract items that might be involved with suicide. These 4 suicide prevention peer specialists are operating on the Northwest, Southwest, Central, and Eastern Washington regions. Each one of them can be reached out to if you know somebody that is experiencing suicidal ideation. It can be a veteran, it can be a service member, it can be a family member. And what these folks are going to do is they're going to have these conversations with them, right? Are you thinking about taking your own life? Have you thought about how you might do these things? And then they're going to work with them to have those real peer-based conversations and identify what their needs are, connect them with relevant resources, and help them to achieve their goals. What they're not there to do is to act as a suicide prevention lifeline. And I just need to emphasize that. We have the 988 lifeline that we refer people to for those that are experiencing in the moment suicidal ideation. What these people are is an upstream approach to suicide prevention, right? It's not suicide intervention, it's suicide prevention. So we're working on an upstream model to work within these communities, provide these learn trainings, and to act as a resource node for those who might be experiencing suicidal ideation. They'll connect them to anyone, right? It can be through a clinician, it can be to food resources, housing resources, whatever it is that you need, they will try to help identify the appropriate resource, not only for the need itself, but geographically as well. They also advocate, for Washington State SMVF populations by promoting veteran cultural engagement trainings, going to stand downs, really generating that awareness of suicide within the state of Washington, specifically to our veteran populations. And they're working with a number of homegrown organizations. So Growing Veterans, Veteran Rights, Task Force 12, Nine Line Veteran Services. So we're really just trying to connect with as many community-based organizations as humanly possible so that we can build a net that can catch these folks, right, as they're coming down and going into that spiral of suicidal ideation. I will be providing contact information at the end of this. If you know of anybody that is experiencing suicidal ideation or might just be showing signs of that, I highly encourage you to reach out to these folks. They will connect you with somebody that can help, or they'll connect you with that resource, and they'll take the time to really just sit down and listen to you, hear what your needs are, and be that peer. So I worked in suicide prevention for approximately a year. And then another position opened up that really just spoke to my heart in peer support. That was our Veteran Peer Corps. Now, I've been working on this program for almost a year now, officially, but I was working on this program prior to that as we identified what this could evolve into. So the Veteran Peer Corps is an education program, first and foremost. We've developed a veteran cultural engagement training that takes approximately 2 hours. Where we dive into concepts such as the battle mind to home mind transition. We talk about identifying the second mission for veterans that are getting out of the military, right? Because we're very service-based and we're very mission-based. So we're always looking for that next mission in order to, fulfill our personal needs or to serve the community, whatever that might look like. And then we talk about best practices in leveraging and supporting veterans within your organizations or your communities. This does provide 2 continuing education units and is available to anyone. If you're ever interested, you're more than welcome to reach out to either myself or take a look at the website that's down at the bottom there. And I'm happy to schedule an opportunity for that training. Now, the bigger project that we've been working on since January of 2022, at the very least, is a complete redevelopment of our peer support training. Now, what does that mean? Our peer support training in the past consisted of 8 hours of curriculum where we provided a certificate of education, not continuing education units, just education, which was fantastic. We had a ton of people that were coming in. They wanted to learn about peer support and working with veteran communities. But unfortunately, we didn't have anything for them to feel incentivized to report back to us, to let us know how things are going. We didn't have a system in place for us to be able to track anything. So we said, okay, let's completely redevelop this system. And so we started working with the Washington State Healthcare Authority. And we reached out to them and said, hey, we absolutely love your certified peer counseling program. Could we work together to create a veteran version of that? And so we've been working on this for a number of months, and the WDVA just became a registered training agency to provide certified peer counseling, which is fantastic. I'm so excited about it. What we're going to do is we're going to finish developing the curriculum for our veteran populations and add some supplemental trainings in there as well, to include that LEARN training and that veteran cultural engagement training that I mentioned just a minute ago. But in addition to that, we're embedding 2 additional programs for traumatic brain injury, as well as for tobacco cessation, as well as those fall within our counseling and wellness programs. What we're going to do is we're going to offer this 40-hour course to anybody that wants to serve in a peer support capacity with veterans and their family members. These individuals, as I'm sure most of you know, will be able to walk away with a certificate as a peer counselor for Medicaid reimbursable services and able to be employed using that certificate. So it's a wonderful opportunity, and we're anticipating a stand-up of our first launch in September. This will be open to just about anybody, but if you're interested, please reach out to me and I can put you on a waiting list. We're looking to fill approximately 20 seats, give or take. And so really looking forward to that. This has been a huge development going on for over a year now. And we're very excited to be able to provide this. This is going to look like approximately 4 trainings per year, since it takes about 10 weeks for us to coordinate them. And what we're going to be doing as a result of House Bill 5358 is using some of those funds to look at other education or other peer support type of opportunities in the future. So this isn't set in stone yet, but some of the ideas that we're looking at is looking to bring in other peer-based organizations to provide their types of peer support training. For example, Veteran Rights provides a Mirroring for Intent and Empowerment workshop, which is a great complementary training to go with peer supporters. So we'd like to look at bringing them in to provide that wraparound complementary peer support type of training on the months that we're not providing this 40-hour course. We're also looking to reach out to growing veterans and the ETS sponsorship so that we can have them come in and provide their education and training as well. So this is continuously being improved. We're hoping to stand up in September, but as we continue to develop, we're going to be looking at opportunities to build out more programs, right? We want to look for opportunities to bring in peer supporters, specifically veteran peer supporters. So that might take on the form of a veteran peer support conference someday. We're also looking for opportunities for us to bring in peer support interns, right? So we want to give people the power to be able to work within the community and pay them for it, right? Again, these are all items that are on the future or on the horizon, but we're really looking forward to the opportunity to develop these things. And I hope you look forward to finding out more. And so for our final program, I'd like to talk about our Staff Sergeant Fox grant program. This is brand new. I just stepped into this position this January. And I apologize. I have a 4-year-old here today, and I'm wearing my dad hat, metaphorically. So if I get distracted briefly, please bear with me for just a moment. So the Staff Sergeant Fox grant program is brand new. And what we are hoping to do is to place individuals within 2 specific regions. Our North Puget Sound, you can see in our blue highlighted there, is going to consist of the Skagit, Whatcom, Island, and San Juan counties. And then our North Central Washington region is going to consist of our Chelan, Douglas, Grant, and Kittitas counties. Now, we've just hired 2 individuals to function out of these 2 groups that you see there. And what these folks are going to be doing is providing peer support and case management services. So what does that look like? Well, if we have an eligible veteran or family member, and eligible means that you have a CAC card, a retiree card, your DD-214, some form of verification that can confirm your status, and you have suicidal ideation. Those are our requirements, and that's it. Once these people are screened in, we're going to conduct intake. We're going to conduct needs assessments. We're going to sit down and really find out the roots of, what's causing them grief in their life. And we're going to conduct a couple of behavioral health assessments for pre and post analysis in the program. These folks are going to work with these individuals on a long-term basis to provide that peer support and case management. So they'll connect with them. They'll identify what their needs are. They'll connect them with those resources, and then they'll continue to check in on them on a weekly or perhaps daily basis, whatever that individual needs based off of their current circumstance. They're going to be working in tandem with our Veteran Peer Corps, as I mentioned in the previous slide, to help provide that peer support education in the 40-hour certified peer counselor training. They're also going to be working to engage with communities through outreach, promoting education and opportunities to engage with other programs, both internally to the WDVA as well as externally, and partnering with the Washington State Governor's Challenge to end veteran suicide as well. And so what'll end up happening is once you come in, you have conducted your intake and your behavioral health screenings, you've done your needs assessment, and you've got consistent check-ins with this peer support case manager. They're going to continuously meet with them until they are done, until their needs are met. There is no end date. It's not you're here for 1 year and then you're taken care of. You're here for 6 months and then you're taken care of. It's until either this program runs out of funding or until your needs are met. And they will continue to keep that chain of communication going the entire time. One moment, please. Ah, 4-year-olds, they're wonderful. All that for a different TV show. So, as I was saying, these individuals are going to have the opportunity for really intimate one-on-one connections with these peer support case managers. And the whole purpose of it is that suicide prevention upstream model of approach, right? This is, as I mentioned, brand new. We are currently in development stage, and we are currently just in the hiring stage. And so we are greatly looking forward to this opportunity to work alongside other organizations such as 9 Line Veteran Services, Permission to Start Dreaming are also Staff Sergeant Fox grant recipients. And we are working to build a network of peer support through that program as well. We are partnered with, partnered is the wrong term. We're contracted with the ETS sponsorship, which if you haven't heard of the ETS sponsorship program before, it's an amazing program. What this program does is they connect with transitioning service members. So Eric Burns at Fort Drum, New York, is 6 months out from getting ready to leave the military. What they'll do is they'll connect with an ETS sponsor that is at the location that they're getting ready to go to. So me, Eric Burns, at Fort Drum, New York, I'm getting ready for my ETS date, which is expiration term of service. I'm leaving the Army, and I'm going to go to Tacoma, Washington, because that's where my family is, or that's where my spouse's family is. That individual will connect with me 6 months prior and start teaching me about what resources are available in the community that I'm going to. They'll help me to identify what my goals are and help develop a plan on how to achieve those goals. Now, where does the connection come between ETS and Staff Sergeant Fox? Well, as I mentioned, Staff Sergeant Fox staff members are going to be facilitating that 40-hour course. That 40-hour course is going to be administered to our ETS sponsors that are going to be working with those transitioning service members. So we're providing peer support and education for a full week. And then those individuals are receiving an additional 2 to 4 hours of ETS sponsorship training on how to navigate through their system. Now they're connecting with those transitioning service members that have a certification in peer support, formal training in suicide prevention and traumatic brain injury, as well as substance use, substance use recovery patterns. Yeah, that was difficult for a second there. And veteran cultural engagement as well. What we're trying to do is provide a whole wraparound education service for these individuals to prepare them to provide the best service possible for these transitioning service members. Once they leave the military and they arrive at their destination, they have the choice if they'd like to continue working with these ETS sponsors or if they'd like to be done. They can continue working with them for as long as they need to. And what we have as a result of our collaboration between our Veteran Peer Corps, our Vet Corps, our suicide prevention, and our Staff Sergeant Fox programs with the ETS is a system of communication on all levels. So if that individual decides, you know what, I really want to go to college, well, guess what? We have Vet Corps members that are peer support trained, embedded on college campuses. Let's identify a Vet Corps member that we can connect you with to be your battle buddy, right? For those that might not know what a battle buddy is, that's your best friend, whether you like them or not. When you're in the military, you are either assigned or you find a battle buddy that goes with you everywhere. We like to try to model this in our transition out of the military as well. When you're leaving the military and you suddenly lose that system of support, it can be extremely detrimental to your behavioral health, to your overall well-being. And so having the ability to still continue that golden thread of care and that peer support all the way 6 months prior from the time they leave the military up to 2 to 4 to 6 years if they decide to continue and follow education. And then afterwards, through our Veteran Peer Corps and Staff Sergeant Fox grant programs and suicide prevention. So we're trying to extend the timeline as much as possible in which they're receiving that support and trying to minimize the gaps in which they could potentially fall through these programs. It seems like a lot of information, and yes, it absolutely is. But what you're looking at is essentially a spider web of support or a net to catch people as they're coming down that theoretical, metaphorical, suicidal waterfall, right? So that is all of the programs that I had to talk to you about today, but I wanted to provide you with some contact information as well. If you're interested in learning more about the Vet Corps program, you can reach out to vetcorps@dva.wa.gov. With that is a shared email account between our 3 regional coordinators as well as our program manager. Happy to answer any questions that you might have. Our suicide prevention team also has a shared email account, connect@dva.wa.gov. If you ever encounter a veteran that's experiencing suicidal ideation, or maybe it's a family member, please reach out to them. And then for the Veteran Peer Corps and Staff Sergeant Fox grant, you can reach out to me. I don't have a shared email for it yet. And the Staff Sergeant Fox grant program is so new that we haven't had the opportunity to put a shared email on there. But if you reach out to me, I will gladly answer any questions that you have. If you know of any veterans that would benefit from the services that are provided, please reach out to us. We believe in the no wrong door approach. So even if you're looking for assistance in just filing for benefits, we will connect you to somebody that's appropriate for filing for benefits. And so I'd like to open up the floor at this time. It looks like we have about 25 minutes left. If there's any questions, I'm happy to answer them to the best of my ability.
I would absolutely like to say thank you, and how kind and amazing all of this is. I have quite a few people that I work with that I just want to connect to you immediately, specifically maybe for the peer programming training. I know that a lot of the vets that I've worked with throughout the years have a hard time transitioning into civilian life. So I'm really supportive of what you're doing, and given an extra level of care. So thank you. And I'd like
Yeah,
to have your contact information so we can possibly have further conversations.
absolutely. So I'm going to put in the chat my email and my work number.
Thank you. Yes. And my name is Tanya. I'm sorry, I'm off screen. I have some bad
No
allergies
worries.
today.
No worries. I understand completely. Anybody can reach out to me on that email or phone number. Please do not hesitate.
Perfect. And I work with a company called Recovery Beyond. So just collaboration wise, I'd like to have a conversation as well.
Yes, absolutely. Happy to connect, whether it's through the provision of services or if you know a population that would like to receive some of these education components that we have, we're happy to schedule them.
Oh yeah,
and for free. I might add, all of our trainings are free.
In that, for sure. Thank you.
Yeah, of course. Yeah. So for anybody that is interested, these are all no cost, right? So the 40-hour certification is going to be no cost. We will be covering all of that. The cost for veterans cultural engagement training doesn't even exist. And then with our Learn, traumatic brain injury, commercial tobacco cessation, all of the trainings that we provide are at no cost to the population. So please don't let that be a factor in your decision. I'm seeing in the chat here, Washington has a veteran program that may be able to collaborate with. Also gives credit for, yes, absolutely. I absolutely love working with Evergreen. I got to go there during our VetCorps mid-year conference in 2019, and it was a beautiful campus. I would love to connect. In fact, if any of you know of any other organizations or programs that are out there in the state of Washington that provide peer support type of education, even if it's a wraparound type of education, like I mentioned, Veteran Rights provides that mirroring for intent and empowerment workshop. That's a complimentary peer support training. We're looking for those so that we can start bringing these trainings together and we can start providing them under one umbrella in a kind of a one-stop shop. So please, if you know of anybody that might benefit, veterans in the community, please let me know. I'm happy to send out the slides. Yes. And you'll have the contact information on there as well as the websites to find out more information. I want to make sure I don't have any more questions in the chat. I think that's just about everyone. So a little bit short, Amanda, I apologize. About 10 minutes on the button.
Melissa
we have one more.
Melissa has her hand up.
Melissa, please go ahead.
Sorry, I don't have my video on because my internet's not great. Can you hear me okay?
Yes, I can hear you.
Okay, so I don't know if you'll be able to necessarily address this, but just concerned or curious about it. So I actually was a crisis triage specialist for 988 Lifeline, and took the calls and did the risk assessments and triage the calls accordingly. My concern and the reason why I no longer do the position is I understand the VA and how that is all functioning, and I'm assuming that's the direction you are, but it seems like there are separate programs, but they're all kind of disconnected. Are you guys trying to do anything to have some kind of a central, like you talked about the spider web, and I liked that reference to catch everyone, some kind of a system where people aren't falling through. So if somebody calls me at the regional crisis line or lifeline, and I'm triaging them or doing whatever I need to do according to their needs, the follow-up, we didn't have the ability for follow-up unless it's been like a 24-hour just to ensure our safety plan that they've agreed to. is being complied with. Are you guys looking at any of that, or are we trying to find ways to connect that? 'Cause that was the hardest part for me, going home every night not knowing.
Yeah.
So
Absolutely. So one of the biggest challenges, right, is that gap in care. And we are working to try to find ways that we can bridge that gap. It starts off with our outreach and our Governor's Challenge. So our Governor's Challenge team is massive. I believe we're currently sitting at approximately 25 individuals. And it's not just the VA or the WDVA. We've got slip of the text. We've got organizations coming from nonprofits all the way on the ground level. We've got organizations on the highest federal level and everywhere in between, as we try to work with organizations like Task Force 12 and Heroes Homestead, all the way out in Northeast Washington, and really just trying to bring everybody together to form that network, right? Something that's currently in development, and I can't speak to a great extent, but there is a peer support network project that is being worked on. And maybe Amanda can talk to this a little bit. But one of the things that we're looking to help facilitate is the veteran side of that peer support network. So the HCA is working to develop this huge, massive project of intercommunication and peer supporters. Individuals, looking for peer support resources will be able to go there, and the WDVA and the Governor's Challenge will be working to provide that veteran perspective, help provide resources, which is a great tie-in to my next point. With the suicide prevention team, what they're working on currently is a suicide prevention resource database. And what that's going to look like is open to anybody, front facing on a website. What you'll be able to do is essentially look for whatever resources that you need based off of the geographical location, right? So if you need housing assistance, let's just pick one randomly. If you need housing assistance and you go on this website, you can type in, your zip code and then select from a checkbox, I need housing assistance, and it'll pull up a list of verified and approved organizations through the WDVA that can help provide that service or provides that service to veterans in general. What we're hoping to do is we're hoping to disseminate information about this resource database, and the DVA will be part of that. That'll go towards 988 or any other crisis response types of teams. And hopefully that'll allow us to kind of bridge some of that gap, right? So we'll know who we can connect them with. They'll be verified as a trustworthy source. And then you'll have a point of contact that you can keep in touch with as well. So that's just one of the ways that we're trying to bridge that gap, in addition to forming numerous coalitions that are based on peer support or veteran services, suicide prevention. Working with as I mentioned, the Governor's Challenge allows us to kind of branch out quite a bit. And then with the Staff Sergeant Fox grant, we also have this opportunity to build this network even further. I hope that kind of helps.
Well, not really. So forming all of these different groups is great, but the point is, like, we would call them frequent callers, and we had a script we would follow for that, where people would call 20 times a day. And I'm talking, we're dealing with people that are active, they're in an active suicidal. They were, assessed to be positive for certain criteria, where we would have to determine if we're going to do, have the police come without their knowledge, if we're going to, have crisis response team come out, a welfare check, or like you said, just talked about resources. But a lot of the veterans, if you're getting to the point where you are in a suicidal state, you're not necessarily in the mindset, psychologically speaking, to be able to comprehend and to go through all these different options, right? So they're just calling a number. And I'm just saying there's so many different options out there. So what's the difference between having the suicide prevention team or your group versus 988? And if no one's I understand HIPAA laws because I've worked in law for 20 plus years. So I'm wondering where the connection is going to happen. That's my main concern here, because I don't want to see our veterans falling to the wayside. So it was a crushing thing for me, to so much that I left. Oh,
Yeah. So
Yeah.
the Staff Sergeant Fox grant might be along the lines of what you're seeking in terms of information. So with this program specifically, the difference between it and our suicide prevention team is our suicide prevention team is going to provide resources in that moment. They're going to help to talk to them within that moment, and they're going to connect them, but they don't have that follow-up of care. What our Staff Sergeant Fox grant program does is they have that consistent follow-up of care and that consistent communication, both in person or digitally. So yes, they'll connect them with our suicide prevention team, or they'll connect them with the resources that they need, but they're not going to stop at that point. They're going to set up an agreement with that individual in that moment that says like, hey, we're going to connect you with this resource and we're going to do a warm handoff. So I'm going to make the phone call with you, and we're going to help get you set up for your appointment. Your appointment's going to be on, next week on Thursday. So let's connect on Thursday afternoon or Friday to do a check-in to see how it went. And then we'll address any concerns or adjust as needed from there. But they're not going to have them call the 988 lifeline and then leave them be. They're not going to provide them a warm handoff to a clinician for behavioral health services and then say, yes, the box has been checked. This is long-term and goal meeting care. So hopefully that's kind of that connection point that you're looking for. And that's how they're going to be working with both the Vet Corps, the Veteran Peer Corps, and really any organization to provide a consistent communication channel so that they don't fall through those gaps.
Okay, that makes a lot more sense. And I graduated from what was a few years ago, and I don't know if you know Dave Baird. He's the director of.
I do.
Yeah, he was my mentor.
Oh, that's awesome.
So he's the director for the VA here. And I talked to him a lot about it. We started at Whitworth. It was like 2018, where they started the buddy program for veterans, and that one of those people was in my cohort. So how does that connect then, going to school, and how does that connect with part of what is that how is that adding into the benefit of this? Like the transition part?
You mean the buddy program specifically?
Yeah.
I don't have experience with the buddy program, unfortunately.
Okay. Oh, okay.
So I can't talk to it.
Okay, that's okay. I was just curious. All right.
I'll be the first person to admit if I don't know something. I do not want to stick myself in that corner.
Okay, I appreciate that. Okay,
not a problem. Betty, I see you have a question.
I work with a nonprofit. It is Friends of Disabled Veterans, and it's in Eastern Washington. It will be a really good contact for you, Brian Moore.
I would absolutely love to be connected and learn more.
I also work with two nonprofits that are trying to get to be nonprofits. Both of them are working with the idea of having a farm that could come out. One of them is veterans, felons, and newly in recovery, because there seems to be an overlap.
Absolutely. Yeah, I would love to be connected. And if we're talking about, working on farms, we also have another program called the Veterans Conservation Corps. While not necessarily a peer-based program, it does have peer-based elements within it. And it really focuses on teaching veterans and their family members how to dig into the dirt and really dive into that ecotherapy for recovery. So I'd be happy to also conduct an introduction to Kim Pham for you as well, if that would be of interest.
That would be of great interest. I also work with a growing nonprofit, or trying to become a nonprofit, in New Jersey.
Oh, okay. Yeah, absolutely. I'm all for making friends across the country.
I will send out your information to them and get them connected with you.
Wonderful. Thank you so much. I greatly appreciate it.
Thank you.
Yeah. I'm not seeing any other questions in the chat. Were there any other questions that I could hopefully answer? I hope this was beneficial and informative for you all.
This has been wonderful, Eric. I really appreciate all of this wonderful information that you've offered and all of the great questions and conversation that's happened around this. So thank you very much. Does anybody else have any additional information or questions, comments, resources that they would like to add? Or would you like 9 minutes of your life back? Okay, so I see something in the chat. Okay, Tanya, right? Okay, perfect. Eric, thank you so much. I will send out a follow-up email. Eric, please make sure that you send me your slides so that when I send the follow-up email, I'll send the slides out with it. I'll make sure that Eric is CC'd on this email and that we get those all of that information added in too. Next month, when we send out the next Pure Blend follow-up, I will make sure that this link for the recording is added into it so that you'll have the option to see this. If for some reason that you don't go to next month's blend or you don't see it, just reach out and I'll make sure that you get the link to this as well in case you want to show your fellows or your supervisors or your leadership or, you know, your bestie or what did you call it? Your battle buddy, Eric?
Yes.
And so, and be sure to reach out if you want to be a part of, you know, the Pure Blends in the future. If you have a presentation you would like to do, Cindy, I'm looking at you. And that's right. And know that we are here for you. Please stay safe. Please stay cool because we know those warm months are coming up real fast. And if you have any needs or concerns, don't hesitate to reach out. I hope to see you all at the Peer Reception, and if not there, hopefully at the Peer Pathways Conference. Thank you all. Thank you again, Eric. You were wonderful, and we appreciate you. Take care, Washington. Goodbye.
Thank you.
Thank you.
Bye-bye.